Hi, my name is Waqas Qureshi. In this video, you will see the different traditional Medicare value-based payments. This is mainly because I've been asked this question recently. So I'll go over a few value-based payment methods that the Medicare is utilizing to increase the efficiency. So there are three of them. One is hospital pay for performance. One is bundle payments. One is shared savings program. So let's start from the hospital pay for performance. So this is more like fee for service, which means you get paid what you provide. Okay, and basically it's a traditional fee for service, but they added quality into this. Okay, which means you have to provide quality of care, and there are different ways to measure the quality, how many patients are having guideline-directed medical therapy, things like that. And that's how they decide on the payment. They also want you to reduce the readmissions, and there's a 3% penalty. They came up with 6 different diagnoses, 6 different conditions: heart failure, hip or knee replacement, COPD, cabbage, readmissions, pneumonia, and MI. So if you reduce the number of readmissions for these, you can avoid the 3% penalty. And then reduce the number of hospital-acquired conditions. This is 1% penalty. So if you are in the bottom 25%, you're going to get penalized. So 75% will not. So this is really the cost-cutting method, is basically by penalizing the hospitals. So majority of the hospitals or care systems are in this. Then there's bundle payments. There are 32 clinical conditions, and they just give you a bundle of payment. It's a fixed dollar amount for the facility, for the doctor, and for the post-acute care. Okay, so you get just one amount. And I'll tell you about those 32 episodes. So to make more money in this situation, how are you going to do that? For the facility and the doctor, you have to take away the post-acute care. Okay, so like rehab, home health services. So you want to do that, So less and less hospitals are now participating in it. Initially, there were quite a bit of hospitals that do that. And it does not mean, so previously, they were paying everything, as you said, pay for performance. They were paying hospital, doctor, and post-acute care separately. But the bundle payment means you're paying less. You're getting paid less anyway. Okay, so that's bundle payment. I hope that everyone understands what that means. And then there's shared saving program. This is kind of a capitation model, which means there's a fixed amount that is given for a particular population. Okay, so for example, end-stage renal disease, you just get a fixed amount for that population. It is like a traditional HMO. So like HMO would give a doctor to take care of, let's say, 100 patients from that insurance company, a specific number of amount of money. There are only 517, and it may be even smaller number now, ACOs that participate in this. So you get paid for a population, let's say Medicare population that you're serving, a fixed amount of money. And it's up to you, how are you going to utilize? So there's an upside risk, which means it allows the participants, which are Medicare patients, to share in the healthcare savings if their services make care delivery more efficient. So you can get, the ACO can get, if they're efficient, they are saving the money. Let's say they get $100,000, I'm just making an amount, and they're supposed to take care of patients with that, and they saved $20,000. Okay, that's theirs. Okay. Now the downside risk, what's the problem with that? If you go above the 100K, everyone has to suffer. Okay, so this is not a great system. So you want to know about the system if you're going into a hospital where they are paying, they are using this method. It is possible your pay may go down because they have to share the risk. Okay, they have to share the risk between, they may fire your admin, they may fire your NP, they may fire your support providers. So you have to be careful about going into a system like that. It's possible your pay may not increase because where will they get the money from? So most likely they're going to get more loans, they may sell it to the equity holders or something like that to get that amount of money. Anyway, these are 32 clinical episodes. I'm a cardiologist, so I'm just going to talk about the heart failure, MI, kind of stroke, and then there are a bunch of cancers, traumatic brain injury, and as an outpatient, chemotherapy, radiotherapy, dialysis, and then multi-setting like cardiac rehab is included in that. Okay, so this is all about how the value-based systems work. If you have any questions, please let me know or ask any questions, comment below so that I can answer those. That's pretty much it. Thank you so much.